Hello, everyone. My name is Olivia Spinhern, and today I'll be presenting on type 2 diabetes mellitus. This presentation will cover the pathophysiology, clinical manifestations, diagnostic evaluation, and evidence-based treatments. I will also integrate the ACE and Essentials Domain 1, Knowledge for Nursing Practice, to connect advanced pathophysiology to high-quality patient care. A little bit about my background. I've been a nurse I've been a registered nurse with experience in the emergency room, remote nursing, and education. My passion is helping students and patients understand the why behind disease processes. Type 2 diabetes is a condition that affects millions of people in the United States and globally. It's an area where strong understanding of pathophysiology can significantly improve patient outcomes. Today, I'll walk you through a detailed but practical overview of this disease. By the end of this presentation, you'll be able to do three things. Explain the cellular level pathophysiology of type 2 diabetes, analyze clinical manifestations and diagnostic tests for evaluation, and develop an evidence-based care plan that incorporates lifestyle, pharmacological therapies, and multidisciplinary support. These objectives were written using Bloom's taxonomy to ensure a higher level of learning. Type 2 diabetes is the most common form of diabetes, accounting for 90 to 95% of cases. It's characterized by both insulin resistance and gradual decline in pancreatic beta cell function. My patients have had Many patients have had abnormal glucose metabolism for years before the diagnosis is made, which means early recognition and prevention are key. The disorder is strongly linked to metabolic syndrome, lifestyle, and genetics. The first major problem in type 2 diabetes is insulin resistance. The body is still producing insulin, but the cells don't respond effectively. In muscle tissue, this means glucose uptake decreases, causing hyperglycemia. In the liver, the body keeps producing glucose even when levels are already high. And in adipose tissue, increased liposis leads to elevated free fatty acids which further worsen insulin resistance. This cycle becomes self-perpetuating and progressively harmful to the patient. The second major component is beta cell dysfunction. Over time, the pancreatic beta cells lose their ability to produce adequate insulin. Several forces contribute to this, such as glucotoxicity from chronic high blood sugar, lipotoxicity from excessive free fatty acids, and genetic factors. Beta cell decline is progressive, meaning that the longer someone has diabetes, the more likely they will need medication adjustments or even insulin. Many patients are asymptomatic in the early stages of the disease. Once blood sugar rises significantly, they may experience polyuria, polydipsia, polyphagia, fatigue, and blurred vision. Recurrent yeast infections or slow wound healing are also common cues. Numbness or tingling in the arms and legs can indicate neuropathy. Some patients lose weight while others gain weight due to insulin resistance and metabolic changes. Diabetes can be diagnosed with a hemoglobin A1C of 6.5 or higher, a fasting glucose of greater than or equal to 126, a 2-hour oral glucose tolerance test of over 200. Beyond glucose testing, we also would evaluate the kidney function, cholesterol, urinary albumin to assess for complications at the time of the diagnosis. There are several well-established risk factors. Obesity and inactivity are two of the strongest modifiable contributors. Age, hypertension, and elevated lipids also increase a patient's risks. Genetics plays a powerful role as well. Having a first-degree relative with type 2 diabetes can double someone's risks. Researchers have identified genes such as the TCF7L2 that influence insulin resistance secretion and glucose metabolism. This highlights the importance of both the prevention and the early screening. If diabetes is not well controlled, patients face both microvascular and macrovascular complications. Microvascular complications include neuropathy, nephropathy, and retinopathy. Macrovascular complications include coronary artery disease, stroke, and peripheral artery disease. Because many of these complications develop silently, regular screenings and early intervention are essential. Type 2 diabetes care is truly multidisciplinary. The provider will manage the medication and monitoring, but the dietitians play a huge role in meal planning and carbohydrate education. Diabetes educators can help the patient learn glucose monitoring, insulin administration, and lifestyle skills. Exercise specialists and or mental health professionals can help with sustainable behavioral changes, such as coping with the disease process, learning how to appropriately manage exercise routines. This team-based approach leads to the best long-term outcome for the patient. All components of the team must work together to have a comprehensive plan for the patient to be able to move forward and be successful in their treatment. Pharmacological treatment. Metformin is almost always the first line therapy because it's safe, effective, and improves insulin sensitivity. Patients with cardiovascular disease may benefit from GLP-1 agonists. Sometimes oral agents are not enough and basal insulin needs to be added. Medication selection should be individualized based on the patient's comorbidities, the way they're handling the medication, and should be monitored very closely by their provider. Lifestyle interventions are foundational in diabetes care. Even the modest weight loss of 5 to 10% can significantly improve insulin sensitivity. The DASH diet has a strong evidence of supporting physical activity of 150 minutes of moderate exercise a week can improve glucose uptake in the muscles. Patients need to be encouraged not to begin an exercise treatment plan until their physician has medically cleared them to do so. Lifestyle change is challenging, and ongoing support and realistic goals are essential. Making sure the patient doesn't feel alone in their decision and has a strong support system can aid in the success of their treatment. Education is a critical part of diabetes management. Patients need to understand monitoring, signs of hypo and hyperglycemia. They need to provide foot care because it is incredibly important due to neuropathy and poor circulation that can increase the risk of ulcers. Patients should also understand the importance of annual eye exams and kidney monitoring. Successful education empowers patients to manage their conditions safely and confidently. It's important that we know as healthcare providers that one session of education is not adequate for a patient to then be able to care for themselves on their own, but rather continuous education, multiple forms of material that can help the patient. This topic aligns closely with the ASIN Essential Domain 1, which focuses on applying scientific knowledge to nursing practice. By understanding the cellular and systemic mechanisms of type 2 diabetes, nurses can anticipate complications, interpret diagnostic data, and personalize care. Domain 1 ensures that nursing practice is grounded in pathophysiology, genetics, pharmacology, and evidence-based decision making. These are the references used throughout the presentation. All sources are peer-reviewed and align with APA formatting. Thank you for listening to my presentation.